welcome to the Midland County Health and Human Service Council's Health Improvement Plan report to the community. My name is Sarah Kyle, and I'm Executive Director of 211 Northeast Michigan, where I have the pleasure of representing my agency on this council, and for the past 2 years, I've had the honor of serving as chair. Although the past 2 years have been rough on our county, state, country, and world, I am actually very proud of the work that we have done for this community together. Next slide, please. The Health and Human Service Council of Midland County was started in 1998 and has a strong mission to promote the welfare of the community through systems-level planning, collaboration, and promotion of health and human services with an emphasis on effectiveness and prevention. As a council, we work on collaborative funding and planning. Many projects require our endorsement and/or evaluation. We also spend time making sure that we leverage expertise and resources to truly have a collective impact. Our backbone agency, the Midland County United Way, has helped to ensure that we have a strong group of over 25 leaders that includes representatives from nonprofit health and human service agencies, philanthropy, law enforcement, healthcare, city and county services, as well as the faith community. I'd like to acknowledge the executive committee and thank them for all of their contribution. The previous chair is Sam Price of 1016 Recovery Network. Dina Mason is the incoming chair from Community Mental Health for Central Michigan. Emily Lyons of the Midland Business Alliance is our vice chair, and Holly Miller of the United Way acts as our secretary. Included in our executive committee meetings, we have representation from Sharon Mortensen of the Midland Area Community Foundation and Fred Unoski of the Midland County Health Department. Most importantly is our coordinator, Kim Stuhler of the United Way, who keeps us all on track. It's been a tough couple of years, but a tagline we use at 211 is, "Don't struggle alone." This group of leaders has helped to make sure that Midland County agencies, healthcare providers, and more don't have to struggle alone either. Thanks for joining us. I'm pleased to introduce you to Sharon Mortensen to talk more about the Community Health Improvement Plan. Sharon?
All right. Well, thank you, Sarah. And again, it's a pleasure to be with you all here today. And as well as my role here at Midland Area Community Foundation, I am part of the Health and Human Services Council, and I chair the committee that works on the Community Health Improvement Plan. If you could go to the next slide, please. Thank you all for your interest in hearing about our community's health needs and the work that's underway here in our community. There are 4 areas of focus, which are shown on the next slide for our current CHIP plan. Those areas of focus are mental health, later life quality, substance use disorder, and healthy living. We'll be hearing from the individuals leading work on these 4 areas, as well as Dr. Kathy Bodner, the medical director for the Midland County Health Department, as she shares about community health during a pandemic. So how did we identify these 4 areas of focus for the Community Health Improvement Plan? Well, we conduct a community health survey, and we've done that for several decades. It's typically done every 4 years. And I will take a little side note here. One is currently underway, and we need your participation. You can access via the QR code that we'll show later in this presentation, or you can go to the Facebook page of the Midland County Health and Human Services and see the link there as well. When we started our Community Health Improvement Plan and identified these areas, it's been nearly 7 years ago, we saw needs based upon the data from our community health survey and also from other publicly available data. We saw the rising mental health challenges both in our youth and adult population. We knew that our older adult population was growing in this community. We saw drug and alcohol challenges very visible here in this community. We also knew that physical activity had decreased and obesity had increased. That led to the selection of these 4 areas of focus for our Community Health Improvement Plan. We started with 3 areas and then added mental health 1 year later as we got underway. Our last community health survey reaffirmed that we were indeed working on the right areas, and we'll use the results of this year's survey to see where we should go as we make plans for future years. So thank you for joining us today, and I'm very excited to hear from the individuals that are leading each of these areas. They'll talk about challenges They'll talk about accomplishments over the past year and areas that they plan to address in the year ahead. And then we'll go to Dr. Bodner as she talks about community health during the pandemic here in our community. We do ask if you have questions to please put them in the chat function. We'll handle those at the end of the presentation. So again, thank you for joining us today. And I'm going to turn it over to those who will be talking about mental health.
Hello, I'm Kathy Dollard with My Michigan Health, where I'm the Director of Behavioral Health Service Line. I'm happy to start the discussion of the 2021 accomplishments. First, leaders of several community agencies came together in a collective work group to develop a plan for enhancing care for patients who come to the hospital due to behavioral health crisis. We were in the hopes of providing better care and enhanced patient experience. We realized that there was a gap in our community that needed to be addressed. So we developed a plan in 2021 and will be starting and have started to implement that this year. Another area of concern was youth suicide prevention. The Rock and Barb Smith Suicide Resource and Response Network have partnered to provide an evidence-based program in our community schools called Peer-to-Peer. Almost all of our middle and high schools in this county are participating in this student-led prevention program, which started last year and has continued in this school year. Now I'm going to hand this over to my partner to talk about other 2021 accomplishments. Do we have Kathy Snyder?
Hi, can you hear me?
Yes.
Awesome. All right. I am Kathy Snyder, and I serve as the coordinator of the Midland Area Wellbeing Coalition. Moving on to number 3. The new My Hope Portal Provider tab addresses compassion fatigue, burnout, secondary and vicarious trauma, and self-care. The new Wellbeing tab provides a variety of resources to help people care for their own well-being and for the well-being of others. And 4. In 2021, we held 2 educator summits designed to identify strengths in schools and community partners across the county, visualize an ideal collaborative future for Midland County education, and finally, to begin to design the space between those current strengths and the future identified goals. Shortly, I'll talk about what we are up to in 2022. Next slide, please, and I'll turn it back over to Kathy Dollard.
We have some big plans to launch for this coming year. First, we have developed a collaborative behavioral health telehub for triaging crisis services. Through the telehub, behavioral health professionals will provide virtual care to patients in our emergency rooms to provide support, safety planning, and care transitioning. In addition, virtual therapy services will be available after discharge, either from the emergency department or from an inpatient behavioral health unit. Grant funding was obtained in 2021 to start up the program. Hiring has started, and we have hired a supervisor and a patient care navigator, and we are starting to interview social workers or psychologists. As soon as we hire these additional staff, we'll be ready to fully launch the program. Now I'll turn it back to Kathy Snyder to finish our discussion on mental health.
Well, second, you can see there, a new well-being priority area was added to the mental health goal. This group is tasked with promoting well-being science, wisdom, and practices to enhance overall well-being and prevent mental health issues. The group is working on multiple objectives, including developing a shared language of well-being and continuing to educate the community. The group is also tasked with updating well-being resources to increase engagement across Midland County with a focus on accessibility and equity of well-being resources. And finally, as a result of the educator summits in 2021, dozens of people across the county are working together to meet the social, emotional, well-being, and mental health needs of all stakeholders in the education space through foundational, targeted, and individual supports. The work groups are aiming to optimize collaborations between schools and community partners across the county, identify gaps in services, and work to fill them in areas of programming and measurement for both staff and students. This critical need was highlighted by a recent Youth Mental Health Advisory Report released by the Surgeon General, Dr. Vivek Murthy. As you can see, there are many exciting and important things happening in the mental health priority area. Next, we will hear about later life quality.
Good morning, Charlie Schwedler, Executive Director of Senior Services. It's my pleasure to represent the folks that have been working so hard on later life quality. Obviously we're talking about older adults, and sometimes people ask me, what do you mean by older adult? And I say, well, an older adult is whoever is 20 years older than I am. And I think everybody says the same thing. However old you are, put 20 years on, that's when older adult is. In all seriousness, what we work with are people that are at least over 60. And one of the things that's real clear is that people are on different journeys as they become older. Some are very active, very late in age, and some, for all sorts of reasons, become less healthy and less active, even younger. So we want to make sure that we are making sure that there's great quality in all of that time. So our accomplishments in this past year, we really increased our outreach to older adults due to the flood and pandemic. A couple of the things that were really special about this is all the groups that we worked with found different ways to reach out to isolated and lonely folks. I mean, we know what a hardship loneliness is on all ages. It's exacerbated with older adults. One of the main things that we partnered with at Senior Services was with the Midland County Health Department to do vaccine clinics because we knew that if we could get folks vaccinated, we would be able to reach out to them much better without risking their health. So that was a great partnership that we had. We also worked with My Michigan Health with the Bridge to Belonging implementation. And this is a program that healthcare providers are able to connect folks that are lonely, folks that are isolated with area resources that could help them. And so this was a great accomplishment this past year. We continue to work to support vulnerable older adults despite difficulties created by the pandemic. This was mainly through MCVAN, the Midland County Vulnerable Adult Network. And what happened with this was that a lot of folks just couldn't visit, APS couldn't visit. So a lot of things were happening that weren't great, but we really went the extra mile. This group really went the extra mile to make sure that they were helping with those disadvantages. And especially the pandemic and the flood really was ripe for scams and those kinds of things. So we really wanted to make sure that people were aware of scams and we're being extremely careful about those kinds of things. We worked really hard on food insecurity, and folks found different ways all throughout the community to make sure that folks had food. And so this was a real good accomplishment that had happened. In fact, there was a partnership with a group called Regrow Midland, Midland Business Alliance, Community Foundation, Baseball Foundation. Other folks were involved in helping restaurants survive, but B, getting food out to vulnerable folks. And obviously older adults were a big portion of that group. We also continue to have ongoing discussions with healthcare providers regarding discharge. This is a huge deal for older adults when they come out of a healthcare facility, whether it's a hospital or a rehab facility or whatnot, and they go home alone and not really know what to do. And so we're really trying to work with those areas to help those things out. And we made some progress in that area as well. So next slide, please. So we are going to continue to work with isolated older adults. This hasn't changed. We are continuing to look for new ways to do these kinds of things. some of the things that we're talking about. There's a new program through the United Way, friendly callers, where folks will just, make calls to people, try to reach out to people. We're also looking at a program called Keep Our Seniors Safe. And again, it's a way to just make sure that older adults have someone that they can speak with, someone that they can contact, and keep themselves safe. We want to really create a system. This plan, this concern about discharge and has been really on our docket for the duration of the time I've been involved in this group, and we really want to make some headway in this area here. Again, we want to continually collaborate with the community partners, law enforcement, prosecutor's office, APS, to work to assist vulnerable adults who are being taken advantage of, and we just want to make sure that they're safe. Again, we're going to continue with a focus on loneliness with Bridge to Belong in partnership with My Michigan Health and 211. I should have said that earlier. I apologize, Sarah. But that's a great partnership, and it has really bore some fruit. And then we are going to continue to have great partnerships with both private and nonprofit organizations that work with older adults and making sure that we're meeting their needs. And when we're not, we're finding a way that we can do that. So that is what we're going to be doing in the next year in later life quality. And so now we will have folks speak about substance use disorder.
And if I could get you to jump back one slide. Hello, good morning, everyone. My name is Catherine Tate. I'm the CEO of the Legacy Center. Together with Sam Price of 1016 Recovery Network, we'll be providing an update on the activities of the Substance Use Disorder Priority Action Area of the Community Health Improvement Plan. 2021 was an odd year as we navigated the ongoing restrictions of COVID, yet found unique ways to support our clients and our community. The Legacy Center coordinates the Substance Use Disorder Prevention and Recovery Coalitions. And in 2021, we had 3 significant wins in this challenging year. First, our prevention team partnered with local schools to implement the in-depth vaping intervention program for students caught vaping at school. The program intends to help young people assess their vaping behaviors, understand their triggers, and consider what cessation might look like to them. The goal is to get them thinking about quitting or cutting back. Through the end of 2021, the program has expanded to 4 local secondary schools, and about 80% of our students that we've worked with report that they are more motivated to quit or cut back. Additionally, our recovery coalition partnered with the local jail and jail chaplain to collect and fill backpacks with items that are helpful for persons entering or re-entering the community after serving time. Each backpack included Narcan, which is a medication that can reverse opioid overdoses, as well as resources to connect them with local treatment and recovery options so that they have support as they exit the jail system and re-enter the community, hopefully reducing their substance use. And finally, in partnership with Midland Kids First, we conducted the 4th iteration of the Midland County Youth Study, which is a survey that asks 6th through 12th grade students questions about developmental assets and risk-taking behaviors. The data has been analyzed, and in the coming months, we'll be sharing the highlights with the broader community. Now I want to turn it over to Sam to share highlights from the treatment side.
So in the context of the pandemic and how that's impacted our community, we look at data that we get from the state about Midland County residents who are seeking admissions into the public system. So using that as a barometer, what we have been able to see is that very consistent with the state, the number of people that are actively pursuing treatment has gone down slightly from last year. But what's interesting to see within that is that in spite some of those decreases, particularly in the area of people who are struggling with opioid dependency, we are seeing an increase in people who have a dependency in methamphetamine. So the issues are real and significant, but they just kind of change and move around. That was one of the reasons that we implemented the Breaking Free application, which allowed the people that are engaged in the treatment services in our community to access an app on their smartphone for when they needed to be able to use some things outside of when maybe a counselor or a coach would be available to them. And we saw that 50% of the time that people were using that were on evenings and weekends, which we really celebrated. Also, our organization, 1016, has been able to celebrate 40 years in this community of active work, and we turned that into really a community celebration of really how recovery is such a great thing. And we had our partners like the Legacy Center and Peer 360 and Community Mental Health and the Health Department kind of come together and celebrate the good things that this community does to support people who are recovering from their addiction and their struggles. Next slide, please.
So during the past 5 years, our team has institutionalized many new processes, procedures, and partnerships, and many gaps that were previously in existence have been filled. In the coming year, we'll be analyzing the results of the Midland County Youth Study and the Community Health Needs Assessment in order to identify emerging priorities and create plans to respond to them.
So in that same fashion, and as we see how the pandemic continues to challenge how we deliver our services and change maybe the different substances that people turn to cope with the challenges of our times right now, we continue to look at how do we adapt our modalities for treatment, recovery, prevention, and interventions as an entire community to continue to wrap around our care for these folks. One of the things that has led to is an opportunity for Midland County to be one of the few counties in the state to pilot a new process called an opioid fatality review, which would pull together key stakeholders to look at these tragic events when somebody may lose their life from an opioid overdose and be able to see what are things that we can do as a community to try and address these and get more responsive in ways to try and intervene sooner and prevent those kinds of losses. So that's the active work that we are doing in the substance use disorder space. So on behalf of Catherine and myself, we would like to pass it on to our good friends in Healthy Living. Thank you.
Hello, my name is Megan Crockett. I oversee the Healthy Living team. We did change our name to Healthy Living Team, previously Healthy Weight Team, just trying to be more all-encompassing of our goals. So in 2021, a few of our accomplishments, we did provide the Prescription for Health program. That program is in partnership with the Midland Area Farmers Market, My Michigan Health, and MSU Extension. So this program offers educational opportunities, different classes for people to learn more about nutrition, cooking, in the farmers market. My Michigan Health helps with funding. They provide funding for participants to earn dollars that they can spend at the farmers market, which is a fantastic resource. And then with that program, we do provide a pre and a post test to measure successes. So this year, folks who participated in the program gained confidence with shopping at the farmers market. There was increased engagement with vendors at the farmers market and increased fruits and vegetable consumption. So this is a program that we have been doing and plan to continue to do. Some great results with that. Again, in partnership with My Michigan Health, there was different recipe cards that have been developed and distributed, highlighting items that are available at different food distribution sites, trying to work with individuals who maybe have some budget constraints, but to provide healthy meal options. And then we've also been planning a food navigator position. What this food navigator position looks like is someone would be present at the farmers market, acting as a liaison with shoppers, connecting them with the farmers, connecting them with recipe cards, teaching them what they can do with certain produce options. Maybe a person comes to the market and they have some dollars that they are available to them to use, but they don't know what to do with something like kohlrabi. So this person would help them to navigate that, teach them what they could do with that, and help stretch their dollars farther. And then we've also been planning a community health fair event. So within the Healthy Living team, we have members of different backgrounds, all with a focus of healthy living. And we'd really love to have a fair type of event to immerse ourselves into the community. As everyone knows, it's been harder to connect in a physical space with folks. And so that is something that we've been discussing and planning for 2022. Next slide, please. And focus areas for 2022. As always, we want to increase access to fresh fruits and vegetables, increase knowledge. That education piece is really important. Again, kind of with the food navigator position and teaching people what they can do. And physical exercise, physical activity as well. We're really hoping to implement this food navigator position in 2022. It's quite an undertaking, and we're very optimistic and hopeful that this can come to fruition in 2022, looking at different collaborations and partnerships with My Michigan Health. And then we plan to continue the Prescription for Health program. It has been very successful, one of those ways where we can really immerse ourselves into the community. We would like to increase the redemption rate of some of the dollar coupons, and we would like to increase accessibility of the program, whether that be transportation or folks with disabilities. We just really want to make sure that we're reaching as many people as we can and working with any limitations that may come up. And then we would love to implement this community health fair event. It's something that we've really been talking about and planning in 2021, and hoping that either this spring or summer, whenever the opportunity arises where it's a safe environment for us to do this, we would really love to have this fair event where we can offer our services and talents to those in the community. And then continuing with our community collaborations. Again, many members of the Healthy Living team are also involved with United Way and the Hunger Connections group, and it's been great to collaborate and work together to accomplish goals where we're working together and not overlapping same goals. So it's been great to collaborate with United Way, and we plan to continue to do that. And with that being said, I will turn it over to Dr. Kathy Bodnar.
Thank you. Hello, I'm Dr. Catherine Budnar, Medical Director of the Midland County Department of Public Health. The COVID-19 pandemic has had devastating effects on many different facets of society. There's been a tremendous toll on physical health. We've had about 200 deaths in Midland County since the beginning of the pandemic. We've also had 15,999 documented cases of COVID-19 as of this morning. And some people have had more than one documented case, of course, and there's also many more cases than have been formally documented because people either haven't been tested or they're testing at home, which is a really great thing. Our hospital systems have been overwhelmed at times, leading to resource strain and staff burnout. Most importantly, timely treatment of other medical emergencies and urgencies are at risk when hospital systems are overwhelmed. COVID-19 disrupts our schools and jeopardizes our students' learning and achievements. There's also a decline in preventive measures such as routine vaccinations, screening for early disease can put, when that gets negatively impacted, puts the population at risk for late detection of serious health problems and also potentially worse outcomes. The mental health toll has been devastating with increased isolation, anxiety, and depression, especially in youth and our senior populations. We've seen increased overdose rates, deaths due to overdoses, increased suicidal ideation, attempts, and completed suicides. We've had to learn as we go since the SARS-CoV-2 virus, the COVID-19 virus, is new. And new information and research gets shared in real time. So we're building the plane as we're flying it, so to speak. We need to remain flexible and to be able to pivot. Vaccination is the path out of the pandemic, and a picture is worth 1,000 words. Please pull up the next slide. Thank you. This is a chart from My Michigan Health, which shows the breakdown of people hospitalized for COVID-19 based on vaccination status. This My Michigan infographic demonstrates vaccines are highly effective at reducing hospitalizations, especially critical care hospitalizations. For those who are age 5 and up, if you're not vaccinated, get vaccinated. If you've only had 1 dose of vaccine, that's a 2-dose series, complete the series. Get a booster as soon as you're eligible, 2 months after J&J or 5 months after the second Pfizer or Moderna. And this is for ages 12 and up. Nobody expects the end of the pandemic will be the end of COVID-19. The virus will become endemic, which means there's continuing low levels of activity in the community with periodic fluctuations, which may very well wind up being seasonal. Throughout the pandemic, your Health and Human Services Council work on the Community Health Improvement Plan has continued. This work is even more crucial with all of the challenges of the pandemic. Thank you for being here to share and celebrate the accomplishments of 2021 and the goals for 2022.
Thank you, Dr. Bodnar. And really what we've heard, as we've heard from each of our speakers today, is the best results come when we work together. Health and Human Services Council exemplifies that, and the work of the Community Health Improvement Plan reflects that as well in our community. The best results come when we work together on tough social challenges. I want to thank the work groups for their important work in these 4 areas. I want to join our community in thanking these work groups, and I also want to join our community in thanking Dr. Bodnar and the Midland County Health Department team for their tireless work on behalf of our entire community during the past almost 2 years. I also want to thank My Michigan and healthcare providers across our community for their incredible work during this extremely challenging and difficult time. What can you do to help? So if you'd like to help, I would like to invite you to please take the Midland County Health Survey. You can hold up your phone to your screen if you'd like and use the QR code. There also is the link there. We put the link as well, somewhat in response to someone in the chat function, so you can view it there as well and save that link so that you can complete the survey. And please invite all of your friends and neighbors in Midland County to take the survey as well. We also ask that you like our Facebook page, Midland County Health and Human Services. You can find it at Healthy Midland, but if you type in Midland County Health and Human Services Council and search, it will also pop up for you there. Again, thank you so much for joining us for this important update on the work that's taken place in the past year in our community and for the plans that we have for the upcoming year. If you would like to engage with one of our work groups, of course, you're welcome to reach out to any of our panelists here today. Also, you could send a message through the Facebook page as well. So again, thank you for joining us. Thank you to all of our Health and Human Services Council members for their work. And thank you to all of you that are a part of this community for the work that you do to benefit and improve the health of our community.